Please begin reading. All right. So if you have read and understood, considering it history taking station, kindly please begin.
Yes, good evening. My name is Dr. Daniel Razak. I am a surgical doctor, and I would like to confirm your name and age, please.
Hello. My name is X. I'm 56 years old.
A pleasure to meet you. Today, I'll be asking few questions regarding your health. Is that okay?
Yeah, sure.
So, what has brought you here today?
Doctor, I have this problem with my what works. I think I see blood.
Mhm. Mhm. I'm so sorry about that. Since when you have been noticing this?
It's maybe 4 or 5 weeks, I think.
All right. So, did it start suddenly or gradually?
I think just suddenly came up. I didn't notice it before.
All right. So, is it specifically coming in your urine, or is it coming from any other body openings?
It's just with the urine.
All right. So, is it painful or painless?
I have this like slight pain maybe on the left.
Oh, all right. So, and what is the color of the blood?
Yeah, it's red, I think. Yeah.
All right. So, when do you see the blood more? In the start of the urine, mid, or at the end of the urine?
Yeah, I think I don't know, maybe just I didn't notice that.
Okay. So, are there any blood clots in them?
Clots?
Yeah. Are there
Blood
any blood
clots, you
clots?
mean?
Yeah, yeah. Blood clots in them?
No, no.
All right. So, what do you think? What increases the bleeding and what makes it worse, or what makes it better?
I don't know, doctor. I don't think um I don't know exactly.
Okay. So, talking about the pain, where exactly do you feel the pain? Can you point out to that side for me?
I think it's on the left side of my tummy. Like,
Okay. So, have you taken any medications for that?
no, not yet.
Okay. All right. So, do you notice any unintentional weight loss during the course of 5 weeks?
Yeah, I think I lost some weight.
Okay. So, how has your appetite been? Is it decreased too?
I think it's not as before.
All right. So, do you feel any fever?
Not fever.
Okay. So, how many times in a day you go for urine?
I think it's just normal, like 2, 3 times maybe,
Okay. So, do you
maybe
feel
more.
any Okay. All right. So, do you feel any uncontrollable urge to pass urine?
No,
Okay. And how many times do you get up at night?
not much, maybe once or not at all.
Okay. And do you feel that your stream is weak?
No, I didn't notice that.
Okay. So, do you feel any dribbling at the end of urine?
No,
All right. So do you take any blood thinners?
No, not
All right. So have you
no
ever had,
medication, I told
okay,
you.
okay, thank you. So have you ever had any history of injury to your tummy or groin?
No.
Okay. So do you see your GP for any other medical conditions?
Yeah, I have my blood pressure is high and I think it's under control and
Or
it's
okay,
and yeah, that's
okay. So do you take
yeah.
medications for blood pressure?
Yes.
Okay. So have you ever had any surgery done?
No.
All right, thank you. So is there anyone in your
Welcome.
family ever had the same complaint?
Not that I remember.
All right. So can I ask you some personal questions? Is that okay?
Yeah, sure.
So what do you do for a living?
I am a factory worker.
All right. So do you smoke?
Yes, I do.
And how many packs per day?
Pack, pack and a half maybe.
Okay. So do you drink alcohol?
No,
All right. So do you have any blood transfusion history?
no.
All right. So before we go further, I want to ask you, what do you think the cause of your complaint is?
I don't know, doctor. I'm just worried that I don't know. I read some, stuff on internet. I'm afraid this could be cancer or something serious.
Right. So your concerns are valid and we will try to address them. And what are you most concerned about?
Yeah, as I told you, I'm concerned if it's cancer or not.
All right. And what are you hoping us to do for you?
I hope you can find the cause and what's causing this and mm,
Okay.
Sure.
get me
We will
treated.
try. Yeah,
Thank
we will
you.
try our best for the management.
Thank you. Can you please summarize
Thank you.
your history taking?
Yeah. We have 56 years old gentleman, and he's known hypertensive, and he presented to us with the complaint of painless hematuria for the last 5 weeks, and that was gradual in onset, and he has no prior history of trauma and no prior history of hematuria. He has lost significant weight in the past 5 weeks, and he has no aggravating or relieving factors with respect to hematuria. The hematuria is associated with the dull, aching left-sided loin pain, and for which he has not taken any medications right now.
And
So
he's
my
effective,
patient,
and he's effective worker. Okay, can you please tell me what are your provisional and differential diagnosis for him?
yes, ma'am, the provisional diagnosis could be bladder cancer
Okay,
or benign prostatic hyperplasia,
yes,
urinary tract infections,
yes.
and renal stones.
All right. How do you intend to manage this patient?
Yes, for the management, I would like to examine the patient first by
Yes,
the general physical examination,
yes,
the abdominal examination, including the DRE,
yes.
and I will also do the genital examination. And after that, I will order some blood investigations that includes full blood count, urea creatinine electrolytes, coagulation profile, and LFTs. And I would run urine detail report to see the hematuria by the urine dipstick test. I will run urine culture to see for the infections and probably go for the cytology. After the routine investigation has been done, I will go for the radiological investigations that include the ultrasound, kidney, ureter, and bladder to look for any obvious causes. If something sinister comes, then I will proceed for the CT scan abdomen and pelvis.
All right. What treatment can you offer to your patient?
Yes, if there is any obvious cause in the urinary bladder or kidney and ureter, I would proceed him for the cystoscopy. And if there are any lesion in the bladder, then I will go for the cystoscopy and biopsy.
All right. Okay. So, yes. All right. What surgical treatment could be offered? If non-surgical treatment fails, or
Yes, ma'am. The surgical treatment options include a transurethral resection of bladder tumor
Yes.
and adjuvant chemotherapy, radiotherapy, and immunotherapy,
Yeah.
depending upon the stage. And I would discuss this patient in MDT for the
Yes.
further management.
First, you will discuss it with MDT and then you will manage it like this. Okay, good. Right. Thank you. There
Thank you.
will soon, because I added 1 more minute so that we could. Yes, now I added 1 more minute so that we could discuss the treatment in detail.
Sure, ma'am.